In this video, we're going to look at fascial or relaxation breathing. Breathing is obviously a very important vital function for our mind and our body. It is controlled by our nervous system, and in particular part of the nervous system which is called the autonomic nervous system, which means that it is all the functions that we don't consciously control every day or every night. So it includes things like our heart rate, our breathing, our digestion, and all the other functions that keep us alive. So the autonomic nervous system is the oldest part of our nervous system, and it goes right back to prehistoric times. It has two parts to it. It has fight or flight and rest and digest. And these two parts of this system work in opposition to each other. So if one's working, the other one isn't. And the idea being that between them, they keep the body and the mind balanced somewhere in the middle, which is called homeostasis. So it's a state of balance in your body. And sometimes this can go a bit out of kilter. So the fight or flight response is exactly what it sounds like. It is a response to anything that is a danger or a perceived danger. So in prehistoric times that might be something literally like a saber-toothed tiger coming towards you to attack you. In that situation you need to either be able to fight or to run away, flight. So the fight or flight response does certain things in our body. It will speed up our heart rate, it will speed up our breathing, and in particular shallow breathing here in the top of the chest. The idea being that we can then pump more oxygen around the body more quickly to our muscles, because our muscles need to be able to work quickly and efficiently. They tense up, ready for action, and other systems in our body that we don't particularly need at that moment, so for example our digestion, slow down. The rest and digest system is the complete opposite to that. So when you are resting and digesting, our heart rate slows down, our breathing becomes more deep and much more down here in our diaphragm, our muscles relax, and our digestion starts to work normally. So both of these systems, fight or flight and rest and digest, work all the time, day or night, whether we're awake or asleep. Generally, rest and digest tends to be more active at night, and fight or flight more active during the day. But between them, they should both be working to help keep us safe and sound. Sometimes, when we're in very stressful situations, we find that fight or flight actually starts to take over. And from the mind and the body's point of view, it doesn't matter whether it's a real danger, so saber-toothed tiger or somebody running towards you, or it can be a perceived danger or a stress. So for example, being in a stressful job, or particularly being in a situation where we can't control the outcome. And if this happens for a long period of time, then fight or flight takes over, and the new normal becomes shallow, fast breathing, increased heart rate, tense muscles, and a very sluggish digestion. One of the many stresses that can cause fight or flight to do this is chronic pain. And so one thing that can be very useful to help undo some of that fight or flight response and help to stimulate the rest and digest is to work with our breathing. And in particular, to focus on this area here around the diaphragm at the bottom of our rib cage. And I find if I'm going to do fascial breathing, one of the best ways to do this is combined with the towel stretch. So the towel stretch is where you use a big towel like this, rolled up as a sausage, as something that you can lie on. So a bath sheet is really good because it's long enough to do this properly. So in order to do the towel stretch, you need to make sure that your head and your bottom are actually both on the towel as you lie on it on your back. The reason for this is that there are nerve clusters at the base of your skull and the base of your spine that help to stimulate the rest and digest part of your nervous system. So when I lie on the towel, I can either lie like this with my legs straight out, or if this causes any discomfort in my lower back, I can bend my knees up. So either is fine, it's whatever is comfortable for you. So the towel stretch helps physiologically to relax your body as gravity starts to pull it back down to the ground. But today the main focus that we want to have is on our breathing. And so if you place your hands on the bottom of your rib cage, so they're half on your rib cage, half on your tummy, and just notice your breathing. So notice whether your hands are moving. Sometimes when we are shallow breathing, there's no movement at all in the diaphragm. All your movement can be up here in the top of your chest. But for fascial breathing, we want to relax the body and we want the diaphragm to start to move properly, because your diaphragm is your main muscle of breathing. So as you breathe in, you should feel your hands move up and out with your rib cage. And as you breathe out, you should feel your hands move down and in, again with your rib cage. So just take a few breaths and notice how much your hands are moving. And throughout this breathing exercise, keep your focus on what your hands are doing. The more they move, the more your breathing is happening in your diaphragm, and the more your body will relax in response to that. It's a natural physiological function that if you breathe diaphragmatically, then your body and your mind will relax more. So when you start to do fascial or relaxation breathing, it's a good idea to start by counting your breath in and your breath out. It doesn't matter what that count is, just as long as you breathe out for a bit longer than you breathe in. So for example, if you breathe in for a count of 5, 1, 2, 3, 4, 5, then breathe out for a count of 7, 1, 2, 3, 4, 5, 6, 7. And keep breathing like that. So breathing in, 1, 2, 3, 4, 5, and breathing out, 1, 2, 3, 4, 5, 6, 7. So as you do fascial breathing, keep counting the breath in and the breath out. Just checking that the out breath is always slightly longer than the in breath. The reason for this is it helps to relax your body more. Sometimes when you reach the end of your out breath, you can just pause there for a moment. That helps consolidate the relaxation in your mind and your body. So I'd recommend when you start doing fascial breathing, maybe just start with a few minutes and then gradually build up the time that you do. If you've been shallow breathing or stress breathing for quite a while, you can sometimes find it's quite challenging when you start to do fascial relaxation breathing. So don't ever breathe until you feel that you're forcing the out breath, or you feel that the breath that you're counting is too long, either your in breath or your out breath. If that's the case, shorten your count and make sure that your breathing stays nice and relaxed so that your mind and your body can just let go. So you can find lots more information about myofascial stretches and exercises to help with chronic pain conditions and stress in our Living Pain Free online programme, which is available on our website.